couple of weeks ago.
Yeah.
So I'm Steve Aldridge. I'm a former director of architecture, Fidelity Investments, and I recently
Okay. This is I've been speaking to different job networking groups and business groups and really individuals in insurance for this will be my 19th year next year. And I got to tell you, this is probably the craziest year any of us could recall, right? So I'm going to put this on. I call this the what's next. What could possibly come next, right? Who would have thought in February of this year we would have killer hurricanes like every time you blinked in the southeast, murder hornets, a recession after having a booming economy, especially in Texas, air that you can't breathe in Colorado or California. And at the other half of the world, in Africa, some of the worst locust plagues in history. And then there's this thing called Zoom that's kind of transformed everything. And as a result, it's changed healthcare. It has changed. Think of what it's doing for travel, business and business travel, and then just in terms of presentation. It's been a crazy year. Travel is like, there were people. I know people that were planning to take a cruise back in February, and fortunately they didn't. And then, airlines. If anybody's been on an airline over the last 6 months, you're braver than I am. It's a year of the mask, and it's a year of selfish people and hoarding, like you would believe. But that's not what we're here for. But we have to distance ourselves, and that's changed so much of what we do. It's also changing insurance and healthcare, and it's also created a ton of stress, this isolation and this stress, especially in a job search mode. It's tough searching for work and lining up interviews when you can't physically meet. And it's tough just living when you're isolated. Not since 1917 have we faced such a devastating and dangerous health crisis. It's all happened in 6 months. We were on top of the world in February. Now, what will 2021 look like, which is really what this presentation is about? Is it a return to normalcy, or is it the new normal? Or are we going to be social distancing at the end of 2022? Who knows? We should be hopeful, but at this point, we really don't know. And a lot of what I'm going to present may change based on regulatory changes or changes on a temporary or emergency basis with healthcare. So I'm going to give you my perspective, and some of it. Look at this as opinion and fact, but also expert opinion. I'm a subject matter expert not only in insurance but health care matters. I represent individual and group health insurance plans and alternative options that are not insurance to businesses, individuals who are 65 and up for Medicare and related senior insurance plans, as well as for individuals under 65, and then all the other stuff that go along with it. And then also all the federal, state, and regulatory stuff that changes, and HR and compliance, it changes constantly. I'm not going to talk about Social Security in this, but I've been doing this for going on 19 years. I'm licensed as a broker to be able to speak to you and appointed with every ACA or Affordable Care Act company in North Texas, and there will be some new ones, as well as most of the Medicare companies in North Texas, or at least those that you want to have covered. And a 5-minute phone call is all it takes. Sending me an email is not the way to start. What I need to do is ask you some questions. get some information, then follow up with proposals to you, and then have a discussion. And it doesn't cost you a thing. Some people do charge for this. Um, so you're getting free advice from an expert because I'm paid a commission based upon whatever insurance company you decide upon. And that isn't important to me as helping you make the best decision. And it's a golden rule. Phone calls or texts are preferred over email messages because I can respond to those faster. I'm reading emails this time of year, maybe 2 or 3 a.m. So, and I'm backed up. It may take me a day or two to get proposals back to you, but we will have that initial conversation right away. I share my information willingly during public speaking and one-on-one client meetings. The type of information I give you is, I feel, is important. Unlike an e-commerce store going directly to healthcare.gov, I provide advice and support ongoing and can talk about the changes. 2021 will see many changes in healthcare, partially as a result of things like Zoom, things like pandemics, and things like an election and politics and regulations in Austin and Washington, D.C. Last week, I crawled out of my bat cave. Every year, I invest over 500 hours between October and August to recertify and to understand and to represent all the insurance companies in North Texas, plus 500 hours a year of non-insurance healthcare and benefits research. So I'm ready, and I know what's happening in insurance and regulations, and I can't. This is my, you talk about isolation during August through mid-October. I can't. Especially this year, it's been just nose to grindstone. So I'm really looking forward to these types of meetings. Now, the pandemic has changed insurance, employer-based health insurance. There are 27 million Americans that started the year on employer-based health insurance that don't have it now. And it's really, there's still a lot of people that are employed, obviously, and on employer-based health insurance. But for many people, this is the first time that they've had to shop for their own insurance. Remote work is here to stay, so you may find more 1099 jobs available. And if employers are paying a lot for office space, they may allow employees to work every day or some days a week remotely. Business travel is going to continue to lag. Certain sectors, even DFW, is being impacted now. There was 6 months where government subsidy was propping up companies like American Airlines and Delta and Southwest and other companies in exchange for not having layoffs. Well, and there are companies from, the airlines located here to Pepsi, Frito-Lay that are now having massive layoffs. You have age discrimination. Believe it or not, there's this thing called age discrimination, and I'm sure none of you have encountered that. But it does make a mistake. It does make a difference in terms of healthcare, and I'll talk a little bit here about how things you can do, knowing that are going to improve your chances of getting employed. The mental and emotional impact and stress of the pandemic and social isolation is huge. And we have yet to see the impact of that. It's impacting schools, children, adults. You have health insurance changes and also telehealth and retail primary care. You now have companies like Aetna and CVS joining forces, with CVS being a major provider of primary care. More recently, you may have shopped in a company called Walmart within the last week. Most Americans shop twice a week at a Walmart. Well, they have not only entered the health insurance business by starting their own 50-state insurance brokerage, but they are also slowly analyzing how to get into the under 65 and 65 market. They have most recently announced a week ago a partnership with a very innovative, technologically advanced company by the name of Clover Health. And they are test marketing their own Walmart branded Medicare Advantage plans in Clover Health locations in 6 counties surrounding Atlanta. Kind of looks like Sherman's March on Atlanta. But what they're doing is they're looking at highly ethnic, they're looking at low income, high income, all the different markets under a Walmart brand Medicare Advantage plan. And it's only a few years before they will roll that out once they get smarter on how to do it. Why is that a good thing? The good thing is that healthcare is expensive. And regulation isn't going to change that. All regulation, from my opinion, does is shift the burden as to who pays. We need some disruption in the healthcare industry, and that will impact health insurance. And disruptors like Amazon and Apple and Walmart will get us to the point where we will have healthcare that is affordable and better and more customer friendly and less regulated eventually than what we have today. Okay, let's see. Oh, hold on a second. We're living in interesting times. You've probably seen this. It's a Chinese curse. May you live in interesting times. Well, that's certainly now. For employers versus individual coverage, for many of you, this may be the first time you've purchased your own insurance. So I'm going to go through some basic concepts that you need to understand to help you with this. First of all, insurance is not healthcare. Insurance is a mechanism for spreading and sharing risk of medical expenses. Okay, it's just no different than property and casualty insurance, car insurance, homeowners insurance. It's all about managing risk. Now, let's look at types of insurance. The largest insurer in the country is by far the federal government, Uncle Sam, and then state governments. You have TRICARE for military. You have federal employee health benefits for federal government. You have Medicare. You have state at the state level. You have state employee retirement programs for teachers and for non-teachers. You have Medicaid. The number 2 largest insurer is employer-based insurance, right? And that's probably what most of you have had in the past is insurance through an employer, either as an employee or then afterwards as a COBRA, which has its own set of arcane rules. And then you have individual insurance, which is further segregated by under age 65 for people that are not age 65, and then 65 plus, which is Medicare rules. And I tell you, this is all tremendously regulated. There's different rules. But as you go from number 1 to number 3, there's more risk. There's more belly buttons in a state federal government insurance program than employer-based insurance. Fewer belly buttons with an individual insurance. Under age 65, the younger you are, generally speaking, the less expensive. Age 65 and up, believe it or not, may actually also be less expensive. But ages 50 to 64 and a half, you may find pretty expensive health plans when you go onto your own searching for insurance because of more risk. Now, I want to go off the slides for a second here. And this is from a job seeker's perspective. Okay. Even though you may have your own insurance, whether it's Medicare or planned through the Affordable Care Act or other types of coverage, you could go onto an employer's health plan when you when it's open enrollment, right? So that just the fact that you are a full-time eligible employee, W-2 employee, you raise the risk for the employer. That is not necessarily the only type of age discrimination a job seeker seeks, but it is definitely an important one. So what that means is you may find, especially right now, you may find more, if you are between the ages of even 50 to age 65 or up, you may find that you have better prospects or more prospects as a 1099 individual as opposed to W-2. That doesn't mean you shouldn't look for W-2, but you shouldn't ignore the 1099 opportunities, or in an interview when it's between you and a younger candidate that you don't want to discuss going on as a 1099 employee if you're carrying your own insurance, because that takes that risk away from the employer. W-2, older than average, more risk. 1099, doesn't matter your age, reduces the risk for the employer. Enough said. Okay, individual insurance premiums. Now, how much you pay? It may be subsidized by Uncle Sam based on your income and household size. All right? I'll talk about this in some detail. Now, you have government insurance, you have employer-based insurance, you have COBRA if you are coming off of an employer plan for up to 18 months if the employer had 20 or more full-time eligible employees. Under age 65, or I'm sorry, under 20 employees in Texas, if the company was based in Texas, you have what's called state continuation. State continuation is equivalent to COBRA, meaning you pay the full amount for the health insurance that the employer was paid, plus up to 4% administrative fee, but you only get 9 months of it. So size of your former employer matters. And then you have coverage for plans through the Affordable Care Act, which in Texas is at healthcare.gov. Now, this is the options to cover pre-existing conditions for people under 65. Okay, there's no other options. There's a couple of things that are government-based, such as Medicare, such as CHIP, such as Medicaid, which will cover pre-existing conditions. But I lump those up into the first one. I'm going to talk about these so you understand where I'm headed here. There are different enrollment timetables. Okay, there are timeline for enrollment in insurance that covers pre-existing conditions. Government insurance, you have Medicare. You have coverage October 15th through December 7th for Medicare. You have employer-based health insurance. About 90% of all companies have their open enrollment period now. And so if you're on COBRA and the employer has an open enrollment period, you will be given an option to join that change plan at change rates, generally this time of year for January 1st. You have when you're termed, when your coverage ends with an employer, you have an eligibility period to when you can join COBRA. But as a new employee, you can join as a W-2 employee. If the employer offers a group health plan, you have an eligibility period enroll of not more than 60 days from the first of the following month. So once you get a job, doesn't mean you're going to get insurance right away. It may not happen for 60 to 75 days, depending upon the time of the month. COBRA, this is a special enrollment period where you can sign up for COBRA within 60 days of loss of coverage. And then you have plans in Texas, as a Texas resident, you have plans through the Affordable Care Act, which will cover pre-existing conditions. And in Texas, this is through healthcare.gov. The open enrollment period begins November 1st through December 15th, open enrollment. Everything else requires a special enrollment period, a qualifying event outside of these open enrollment periods. And that is everything from death, divorce, marriage, remarriage, uh, birth of a child, uh, moving from out of state, special situations where you're eligible for coverage. The most important one is loss of coverage, either yours or your spouse, triggers a special enrollment period. Generally, plans that do not cover pre-existing conditions, you can enroll in 24/7, 365. So an enrollment period only matters if someone in your family has a serious, chronic, expensive, or life-threatening pre-existing conditions. These are the options. I'm going to talk about pre-existing conditions, and let's talk about serious conditions first of all. Let's say let's say me. I have a serious, life-threatening, potentially expensive pre-existing condition, and my daughter here has a condition that's not so expensive. You know, it's on a medication that's a generic and it's not that expensive. Now, you could get coverage for the entire family unit for plans that cover pre-existing conditions when it's really only me that needs it, right? And this person, there may be some out-of-pocket expenses, but there's a lot more affordable options for everybody else in the family. So this is a concept called unbundling. When we've been brainwashed into thinking because we've always been on our parents' plans and then we graduated to an employer plan that everybody in the family has to have the same coverage. It's not so. Doing so, you may be spending more money and you're not managing your risk, and you're spending more money and maybe not having enough coverage for those that really need it. What impacts that? Pre-existing conditions. I just talked about that. Age. The older they are, the more you are going to pay for certain conditions. This is one I'm going to spend some time on because we're coming up on open enrollment period. This is income. And the income that you estimate for 2021 may be vastly different if you were termed somewhere during 2020. Your income estimate for 2021 may be way different than it was for 2020. And then also your job time horizon. If you feel pretty confident you're going to be employed and eligible for a group health plan by January 1st, then, or say February 1st, then you just need coverage from now till then. That's less risk, right? It's less risk, and you can manage that risk more affordably by just covering that time period. And it's unlikely that you will, not that it doesn't happen, but it's unlikely that you will contract a serious illness during that period of time. The longer the time horizon, the longer you need coverage, the more risk there is, the more you may pay. And then I mentioned W-2 or 1099 in your future. Right now, don't overlook these, especially if you're in the looking old age, or if you're in the 50-plus phase of your career. You're causing the employer to, as an employee, the employer pays more for the risk of their health plan, whether or not you're actually on their health plan or not. So 1099 may somehow, sometimes, depending on the employer, may reduce the risk because of the employer and what the employer pays for health insurance for the employees. All right, sorry for a lot of taxes, but this is some basics I want to cover. How much you pay for plans through the Affordable Care Act at healthcare.gov is based on your household size, your age, and your income, but not just any income. There's a CPA's nightmare term called MAGI, Modified Adjusted Gross Income. And it is used to establish if you're eligible for premium tax credit and also this thing called cost sharing. You can deduct your traditional IRA contributions if you or your spouse have one. But believe it or not, if you have a child at school, in college that is working part-time, you have a, a, a child working at McDonald's, all that income counts towards your household income, not only you or you and your spouse. Another really important chart, I'm going to spend a minute on this because it impacts how much you pay for insurance. You see this chart, this, and again, 2020 Federal Poverty Guidelines chart is so important. The 2021 chart would normally be out by now, especially with open enrollment less than 2 weeks away, but that's being held up in Congress. When that impasse will happen, I can't tell you. But you can use this as a guide to see what your income, based on your household size and your income, how much of a premium tax credit you may receive. If you're, for the sake of, you know what your household size is, okay? Any child under age 26 can be on your plan if you want. But for the purposes of this presentation, let's just use one. If your income is, it's 2020, you may have made more money in 2020. I'm sorry, it's sorry, I'm going to misstate this. We're looking at 2021 now. Okay, if your income for 2021 you estimate to be below $12,760, then you're below 100% of the premium of the federal poverty guidelines, and as a result, you are not eligible for premium tax credit or cost sharing. So in Texas, we did not expand Medicaid. So normally you would be eligible for Medicaid, but that doesn't exist for adults except in certain situations, which I'll talk about. So you want to make sure that you do what you can for 2021, that your income is between 100% and 400% is where you get a quote unquote subsidy based on your 2021 modified adjusted gross income estimates. Now, there's also this period, this level here, 150% to 100%, you're eligible for what's called cost sharing. And I'll go into detail there, but what cost sharing means that you are not only getting a pretty large subsidy, you'll see in a second, for coverage for what you pay for insurance, but you also have your out-of-pocket expenses, your co-pays, your co-insurance, your out-of-pocket maximums brought down. In fact, between this level, 100% and 138%, you'll have really low costs for insurance and have very low out-of-pocket expenses. But if you're above 400% of the federal poverty level, then you're not eligible for a subsidy, and you will find that plans through the Affordable Care Act, while they will cover pre-existing conditions, they will be more expensive than what a group health plan costs, quite a bit. I did a study 2 months ago for a client who was considering just offering Affordable Care Act plans for their employees who are making beyond the 400%. They were all making, like $60,000, $70,000, $80,000. So they would not have qualified for premium tax credit. And the cost of a plan through the Affordable Care Act was about 40% more than the cost of a group health plan. So I convinced him to offer a group health plan to his employees because it provides a tax benefit to the employer, but much better coverage for less money to the employees than a plan through the Affordable Care Act. So you got that. This cost sharing here, and it's an escalating. It's a negative escalating scale, whatever that's called. But the more you make, up to 400%, the less of a premium tax credit you receive. Now, in Texas, there are about 1.3 million of Texans with ACA coverage this year. 2/3 of them receive a tax credit. Okay, 65% are in this 100 to 250% level. And then about 20% get a little bit of a tax credit. And then here you see these are the people that don't get a lot of that don't get any tax credit, and it can make a big difference in what they cost, what costs are. So this is a key strategy. Now you want to unbundle your health insurance. So again, going back to my example, if you have this is regardless of the cost of the coverage, if this person is the one who has expensive, potentially life-threatening, or chronic conditions that could become life-threatening, this is the only person that should be on a plan, really should be on a plan through the Affordable Care Act, no matter the cost. This person, let's see, where's my cursor? This person who has some pre-existing conditions and the rest of the family, there may be more affordable options than plans through the Affordable Care Act, depending upon your household income. Now that household income that I keep referring to, it's modified adjusted gross income. It includes all of these things, W-2 and 1099 incomes, 2021. What you make in 2020 doesn't matter when you're applying for coverage beginning in 2021. It's what you estimate for 2021. Also rental income, dividends, short-term gains, sale of real estate if it's short-term gain, it counts. Social Security income but not disability income. Unemployment income, the temporary $600 employment benefits, if any. We don't really know about the PPP loans. Those are forgiven, whether that will count. But any new stimulus funds will all be considered income and will impact your modified adjusted gross income. And remember, you're going to get a recording, a link to a recording, and a copy of this slide deck. And you can go back through this and call me, and I can help you through your options. Now, who's ineligible for premium tax credit? First of all, if either spouse has access to a group health plan, there's no tax credit. You pay full boat. And then if tax credits were not resolved from the previous year, or you haven't filed income taxes for the year, then and are not paid, then you're not eligible for tax credit. And in Texas, you're not eligible for a tax credit if your household income is less than 100% or more than 400% of coverage. Now, this thing called cost sharing is what reduces your co-pays, deductibles, and out-of-pocket expenses if you're within that 100% type range of the federal poverty income. Again, these are going to be tweaked a little bit for 2021 once the legislature gets around to stop bickering for a minute to pass things. Now, what's new in Texas with plans through the Affordable Care Act at healthcare.gov? There are more providers in the networks in more counties. There's more competition, which is good. And better is actually the brand name of the largest health insurance company in the country now, named Centene, C-E-N-T-E-N-E, which insures 1 out of 5 Americans. They're here in Dallas County, and they're expanding at Dallas and Collin, and they're expanding into Denton and Tarrant County. They've also increased their network. There's a company out of Colorado called Friday Health Plans in Dallas, Collin, and Tarrant County. They have a very simple, straightforward approach. Their plans are easy to understand. They're the same plans in their group health for their small group health as the benefits are the same in their plans to the Affordable Care Act. There are HSA eligible health plans for the first time in a few years in North Texas. There will be multiple plans there. And largely because of providers, doctors adjusting, and members adjusting to the Zoom world we live in, there's a lot more use of telemedicine and telemental health. And there's more doctor visits with more co-pays on many plans and carriers. This year, 2020, there's a limitation to the number of doctor visits where you could go and pay a flat copay, after which you would get the network negotiated rate if you went in network, but you would you would pay until you meet your deductible. There's also going to be more confusion. Blue Cross Blue Shield is offering, I think, 2 or 3 times the number of plans across 3 different networks now. Know the difference, and boy, if you decide on price alone, you're going to end up with some problems. All of the carriers are using expanded use of generics, and then you have to get file an exception. Your doctor has to file an exception if the generic is found not, if the available generics are found not to work. Also, there are no PPO, Preferred Provider Organization plans in Texas. What's a PPO? That means you can go out of network and you pay a higher rate. It also means you don't have to get a referral from a primary care physician to see a specialist. It doesn't exist. It exists on other plans, but not ACA plans through healthcare.gov. Now, there's a difference between a health maintenance organization, or HMO, or an exclusive provider organization. Again, there's no coverage out of network. The difference is that an exclusive provider organization, you could pick up the phone and call an in-network specialist. With an HMO plan, you have to see your primary care physician, who you're assigned to or you select, who is in network, and then they make, if they can't treat you, then they will refer you to an in-network specialist. There's no coverage out of network. Many of these plans their networks are only in specific counties. Blue Cross Blue Shield's HMO plans are the only plans that are available in each county in Texas. All of the plans that are in at healthcare.gov, they do not extend beyond Texas, and many not beyond a few counties. So if you have children that are in college and you're residing in Tarrant County and your kids are going to Texas Tech in Lubbock, well, they're out of network, and that means you could have expensive health. You have expensive health risk there that isn't being covered by your health plan, and I'll talk about what you can do about that. And then all the plans, you're going to see higher deductibles in individual and even employer health plans than in 2020. This is the company out of Colorado. I think they're getting some real traction, and they're causing the other insurers to improve their benefits. They have unlimited 0 primary care visits on many plans. They include a 0-cost annual wellness exam, unlimited mental health benefits, 0 premium for teledoc services, and urgent care visits at $75. That's caused the other insurers to react. Blue Cross Blue Shield, they have a plan that if you are, again, HMO, this is the same HMO network that employers have. It's very broad. They have an upsell from that, which is a Blue Advantage Plus HMO, where if you're traveling, you can get some coverage out of network that provides you some good flexibility. But they also have a downsell network, if you will, called My Blue Health, which means you can only go to a handful of clinics. You don't have a specific doctor-patient relationship. You have a clinic relationship, and they will, if it's approved, they will refer you to a specialist, but there are very, very few specialists in this network. So anybody going to healthcare.gov and not understanding these differences, what happens? A confused mind never buys. An ignorant mind buys on price. So you got to know some of these differences. Blue Cross Blue Shield has increased the plans, and this and this isn't just Blue Cross, the deductible out-of-pocket maximum for the base plan, unless you're eligible for cost sharing, is $81.50, goes to $85.50. All the carriers will have an HSA eligible high deductible health plan, meaning no copays for doctor visits. You pay the network negotiated rate with an out-of-pocket maximum in network of $7,000 instead of $85.50. With that type of a plan, again, no copays, you pay the network negotiated rate. You can set up what's called a health savings account at any financial institution. Make a contribution into it. If you don't use the money, you put the money in to pay for your out-of-pocket medical expenses, and you get a tax credit for the amount that you contribute each year. You can't set up a health savings account unless you have an HSA eligible high deductible health plan. What's the benefit of that? It is a tax-free way of building money for retirement. The HSA health savings account funds roll over and continue to grow tax-free until you use them in your future. You can use them in retirement when you're in your 70s or 80s. And that money, as long as you use the money that's in it for medical, dental, or vision expenses, you never pay taxes on that money. It's a great deal. And it's a way of building a retirement fund, if you will, for your healthcare needs. A 401k, eventually you have to start paying taxes because you have required minimum distributions now at age 72 as opposed to age 70 and a half. So you have to start taking money out and pay taxes at whatever the tax rate is when you hit that age. With the health savings account, any money you put in that, as long as you use it for medical, dental, or vision, and you eventually will, out-of-pocket expenses, then you never pay taxes on the money. What else is new? Higher deductibles, I mentioned that on both Affordable Care Act plans. Most Medicare Advantage plans and employers are having to do this. Because of that, this should be $85.50. This means more risk. I tell you what, for most people, having an $85.50, having to pay an $8,550 medical bill, that is a hit. So what do you do to reduce risk? Well, you can insure your insurance, cover part or all of the risk of major out-of-pocket expenses. You can get an accident-only coverage to cover the risk of a major accident. One car accident, you can just look at the carnage on 635 or the tollway or other highways around daily, and you see some pretty horrible accidents. Accident coverage for any, say a single parent, age 60, and a 20-year-old child, it may cost $45. About half of that for just one person. You can also cover and bundle other things like hospital outpatient surgery. The more coverage you get here, the more it costs. But accident-only insurance coupled with a plan through the Affordable Care Act is one way to smartly reduce risk. Now, I mentioned out of county, if your network is in a county, and let's say you have a student, could be a child or a grandchild. Student health plans are usually the best coverage available for out-of-area college students, both from a premium expense standpoint and quality of coverage standpoint. And I'm very familiar with all of those in Texas that are available, as well as those in adjoining states, Oklahoma, Arkansas, etc. So if you have questions about that, let me know. But generally, and I would say almost always, the student health plan is going to be better coverage, and unless you're eligible for big premium tax credit, it'll be less expensive. But if you're on a Tarrant County plan and you've got a kid going to Norman or Lubbock and living there, they're not covered. So that's not going to work. So let me know if I can help, or just go to the university website to see what's available there. They're usually semester plans, and you have to have coverage for, your student has to be enrolled for 12 hours or more in order to qualify for the coverage. Okay, now this is, now we're going from plans that cover pre-existing conditions, including student health plans. We're going into plans that don't. Okay, and why do you want to look at plans that don't? Well, one of which is timing. Right now, unless you're eligible for COBRA or you have been recently termed within the last 60 days, you can't enroll in a plan through the Affordable Care Act or have other options available to you that cover pre-existing conditions. But you may be eligible for short-term health insurance if you're up to age 64, and they may be less expensive than COBRA unless you're eligible for a large premium tax credit. They will exclude and deny pre-existing conditions, and they can say, hey, we don't cover you because your condition is too severe. They also don't offer free wellness exams like mammogram, pap smear, colorectal exams, etc. And you don't want to enroll in one of these plans and set a term date that it expires in the middle of the year, because if you get in a freakish accident or something, you may not be eligible to enroll in something else unless you're just lucky and happen to be eligible for a qualifying event that would allow you to enroll in a plan outside of an open enrollment period. So you might have to wait until the next January of 2022. You pay month-to-month coverage, and you can cancel the coverage, and it'll end at the end of any month. We're not going to prorate the month, but it'll stop once you call to cancel coverage. And it takes about 10 to 15 minutes to enroll. You can literally start enrollment today and be covered as of 12:01 a.m. tonight, cover you for the number of days, or just go month to month for coverage through the end of the year. Christian healthcare sharing ministry programs. I can't go into a lot of detail or mention names, but you can talk to me individually. This is one of the areas that I'm not permitted to go into details. These are not insurance plans, but they do manage and reduce risk. And for individuals and families up to age 65 who are Christian or live a Christian lifestyle. You do not have to be Christian, but you have to live a Christian. There are programs. They're not plans, but there are programs that will reduce your risk if you live a Christian lifestyle, which means you don't smoke, abuse alcohol or tobacco, no out of wedlock maternity, or be involved in a DUI. They're very affordable, especially for individuals age 55 and up. And for families, the more people there are on the program, the more risk management and the more cost savings. There's a 20% discount for healthy enrollees and a 20% penalty for those who are less than average health. There is no coverage for pre-existing conditions for the first 3 years, and some programs are excellent. I was on one personally, the largest for 4.5 years until I became Medicare eligible last year. I guess I just told you my age. But some programs are excellent and well run. There are a few programs that are horrible. There are a couple that require you to submit a bill from a doctor or a hospital and wait to get reimbursed by another member of the program, which means you have to pay in the meantime. And there are also there's a couple that are unethical and illegal. There's one pretty famous program that didn't pay claims, and they were shut down by the state of Texas and other states, and so they closed up shop and they opened up magically under another name within a few months. And so you just have to be careful there. But I can answer questions about that on request. But I used it, it worked for me, did exactly what I wanted to do. It covered me from about age 60 and a half or so until age 65. Now, there are certain situations where setting up a small group health plan is a good option. In Texas, the small group health plan regulations, any company with from 2 to 50 full-time employees can set up a group health plan. And the health of the employees have nothing to do with it. There's coverage for pre-existing conditions, and they have access and give employees access to an excellent HMO or PPO network. It has to be a legitimate, ongoing business that generates from a payroll a Texas Wage and Tax Commission report and proof that it is a business or with revenues. It can't just be set up for the purposes of getting insurance. It also requires 2 employees or more with different last names. It can't just be husband-wife. 10 months out of the year, 75% of the full-time eligible employees must be enrolled in group health, except for November and December, which we're in, we will be right now. During the November, December, there can be just 1 employee on the group health plan as long as the other full-time eligible employees sign a declination of coverage. They waive their coverage. So I have a number of clients that have a business, small business, retail business or something, or a consulting company partnership where there's one person who really needs good coverage and the other employee doesn't. So that employee who needs it ends up with a group health plan that covers all pre-existing conditions, has access to a PPO network, and it costs about 40% less than the cost of a plan through the Affordable Care Act if that employee is not eligible for a premium tax credit. The paperwork is a little daunting. I help businesses set this up, and it's a great deal. It's just one of these loopholes as a result of regulations in the Affordable Care Act that allow small entrepreneurial partnerships or businesses to have really good coverage for relative, not that it's inexpensive, but better coverage than what's available if they don't qualify for a premium tax credit. So that's all of the options, with the exception of Medicaid. I get asked this a lot. Who's eligible for Medicaid in Texas? Well, children under the age of 19, based on household income. This is known as CHIP, Children's Health Insurance Plan. Pregnant mothers, based on household income. Adults age 65 and up, based on household income and assets. You have to requalify every 6 months. And there is a clawback of benefits received in the event of an increase in household income or assets. I'll give you an example. Let's say somebody age 70 is on Medicaid, which you'll see the income levels in a second. Well, that person dies, and the estate, there's some life insurance or something. The estate then, the state of Texas will claw back the Medicaid benefits received from the estate. It can hold up probate. Same thing can happen if somebody is on Medicaid as a child, less so for children, but it does happen with pregnant mothers. If a year or 2 later they show large income, the state can claw back some of the benefits received. It is a state program and funding, and benefits are subject to state laws, regulations, and budgets. You can learn more at texasbenefits.com, or for CHIP, TexasChildren'sHealthPlan.org for more information, or call me. Now, this is important because you may have kids who have been furloughed or termed, or you may be responsible for you may have custody of a grandchild. There's a lot of situations. Who's eligible? Let's look at CHIP over here on the right in the blue. And this is family size, adults based on household size, adults plus children. Let's say a single parent with 2 kids. Here's the income limits, okay? Over here for Medicaid for pregnant mothers and adults, here's the income levels for age 65 plus. There's also asset limits. Now, they don't call them premiums, but going back to this chart here, let's look at family size. Okay, let's say it's an adult plus 2 kids, the same example as before. Number 3, and this is CHIP, Texas, the Children's Health Insurance Plan. Monthly income of $3,153 or less. The yearly fee, again, this is yearly. What does it cost? There's zero cost for the children. If and that at $3,199, 2 children, the yearly fee for covering children and CHIPs is $35. $34.51, which is what, about $41,000 per year. The yearly fee is $50 per year for covering children. Great option for children during these times. You do have to qualify. There's some paperwork. It's not automatic, but it is by far the best and most affordable option for children if you are within these income limits. Realize that this is an HMO plan. There are some good plans. You have to use a primary care physician that's in network, and it's liable not to be the same doctor that you had covering the child, seeing the child when you're on an employer-based plan, but it is good, affordable coverage. Now let's talk about Medicare, and I do specialize in this. It's about 50% of my practice now. I represent most insurance agents or brokers will represent 1 or 2 carriers because it is a beating to recertify and retrain to represent multiple carriers. If you ever get solicited by an insurance agent, be sure to ask, okay, who do you represent? They'll probably say, well, we represent United Healthcare. It's the biggest company. And maybe they'll say Aetna also because it's the next biggest. Well, guess which ones they're going to push and twist a little bit so that they look good, so that they look better. Each person's situation is different. There's different networks, etc. I represent, in North Texas, I represent about 16 different Medicare companies, and I put a lot of time into that, but that allows me to really provide unbiased advice and support because no 2 people are the same. There's a reason all these companies exist, and each one has a specific niche that is good for somebody, and it may be you. Who's eligible for Medicare? Individuals age 65 and up. Individuals under age 65 who have been on Social Security disability income, that should be 24 months. So in the 24th month, you're signed up for Part B. It comes up. Part B cost comes out of your Social Security disability insurance check, and you're enrolled, or you can choose a Medicare Advantage plan. And then you can choose other options when you turn 65, once you do turn 65. When do you apply for Medicare? You can apply for Part A, and you always should apply for Part A 3 months before your 65th birthday. The reason why, your employer-based health plan will coordinate with Part A. And if you haven't signed up for Part A and your insurance company then audits at the end of the year, okay, who's age 65? They're going to ask to see your Medicare card with Part A on it to submit the bills to Medicare for reimbursement. And if you haven't signed up for Part A, then you're stuck paying that amount. So Part A, that's what the payroll taxes pay for. That you see all the payroll taxes coming out of your check. That's Part A. Part B in 2020, Part B, as in boy, costs $144.60. Now, Part A and Part B cover 80% of your health expenses. Now, there's this thing that came out during George Bush's administration called Part D, or prescription drug plans, Medicare prescription drug plans. Part B and Part D, you apply 3 months before your 65th birthday, or up your birthday month, or 3 months after your 65th birthday, or if you're past age 65 and you can enroll during your open enrollment period. You can term from an employer's plan, or if you are termed from your employer's plan, you apply just like COBRA within 2 months, 60 days after termination of your group health plan. And then you enroll in supplemental coverage after you get your Medicare card that has Part A and Part B on it. Why is this important? Medicare is a super deal. It is going to change a lot. Why? Because baby boomers like me and Mike and our kids are paying for it. After all, we covered them for a lot of years. But as we become less of a voting factor, as our kids get sick and tired of paying for us, Medicare is going to change. There's already a lot of rumblings you probably have heard on in the media as to what options there are, and I don't want to get into things like Medicare for all and that kind of thing, but Medicare will change, but now it's a super deal. In total, between B as in boy, a Medicare supplement, and a Part D plan, for under $300 a month at age 65, you can have unlimited access to any doctor, any hospital, anywhere in the country in the U.S. that accepts original Medicare, and your only calendar year out-of-pocket expense will be under $200. And it'll change a little bit for next year, but they haven't been announced yet. The $198.60 or the cost for Part B haven't been announced. You also pay co-pays for out-of-pocket expenses. So $300, all you can eat, second, third opinions, any doctor anywhere in the country or hospital except original Medicare. Or for $144.60, which is the current cost in 2020 for Part B, you can get a zero premium Medicare Advantage plan that you can see doctors and hospitals within an insurance network, and you will have calendar year out-of-pocket medical expense risk of anywhere from $3,400 to $12,000 plus your prescription co-pays and out-of-pocket expenses. So why is this important? You may be perfectly healthy now, but when you first enroll in Part B, you have an initial enrollment opportunity to enroll in the top option, out without having to answer health questions. After this period, if you go the other route, and this is Medicare Advantage plans, nothing wrong with that, but you'll have more out-of-pocket medical expenses. And I can't tell you the number of adults in their late 70s and 80s I speak to who have somewhere along the line hit chronic, expensive, life-threatening medical conditions that are paying out this much every month or every year in medical expenses because they went this route as opposed to this amount. This is a known amount that you can budget for in the future and set up your retirement programs to be able to cover this. You're taking more risk. The more risk you take, the more you spend. Also, the more risk you take is not only the cost, but also access to the doctors and hospitals that can take care of you. Now, does your head hurt yet? All this? Medicare Part B and also Part D. To juggle the books for approval of the Affordable Care Act in 2010, $600 billion was rated from the Medicare Trust Fund to show the OMB, Office of Management and Budgets for Congress, that the Affordable Care Act would be tax neutral. So as a result of that, about 2 or 3 months after the passage of the Affordable Care Act, Congress came to agreement because Medicare would have been bankrupted within a year. IRMA is a result of that, and it is a wealth tax that impacts individuals making over $85,000 an individual or couples over $170,000. And it's a 2-year rolling average, and it can double or triple your Medicare Part B costs. Withdrawals from retirement funds, short-term real estate sales, bonuses, if you're shown the door but given a package, that counts as income. It can impact your IRMA assessment, and so that $144.60 cost for Part B for individuals under 85,000 can go up if you're above 85,000 or 170,000 as a couple. You have one initial opportunity to enroll a Medicare supplement plan without answering health questions. That doesn't mean you can't change plans or companies in the future, but if you develop a health issue, then you may not be eligible to change. Most important, write this one down. If you're coming up on age 65 and you're working, COBRA does not count as creditable coverage at age 65. You may be sent a COBRA package at age 65. However, the onus is on you to enroll in Medicare within 6 months of termination, or you'll be subject to a late enrollment period, and also assess premium penalties on both your Part B and your Part D. COBRA, I talked to probably two clients a month, or prospects per month, who signed up for COBRA and triggered the late enrollment penalties and had a delay in their coverage because they didn't know any better. They got their COBRA package, and so they signed up for it. Seemed easy. I'm not going to talk about Social Security, but be cautious of collecting Social Security at age 62 and a half because it'll impact these IRMA amounts. So that's everything. There are no other options. Okay, there are no legitimate offers. Now there are what are called limited benefit plans, and there are a lot of unscrupulous call center boiler room type agents who do sell limited benefit plans with very little coverage, and they represent them as being ACA compliant or covering things that they don't. Be wary. Be very wary of those. Generally those are agents that have been advanced commissions, so they're living on the edge, and they've got to sell their soul to sell you something, or they're facing bankruptcy because they have to pay back their commissions. If it's not COBRA, Affordable Care Act, or Obamacare, or CHIP, or Medicaid, short-term health plans, if it isn't one of these things, be very wary. Your radar should be up. Now, I'm going to talk about how do you choose. You probably have a headache right now. I bet at least half of you have gone for Goodies powder or a couple of acetaminophen, but you can do this yourself. You can go online for quotes. I think there's something like, if you were to Google cheap health insurance quotes, you will find there are 643 billion listings in Google because so many people shop for this online, and then they end up, what's the saying? The confused mind never buys. The ignorant mind buys on price. You got to be very careful. You can sign everybody up for COBRA election, but then you're writing a big check, not for the time being, but from when your coverage ended, which might have been 2 months later plus a month forward. It's a hard check to write. You could sign everybody up for COBRA and end up with too much coverage for some people and not enough for others, and not manage the risk and the cost. And you try to do this yourself. If you get bored or distracted, analyzing and missing deadlines, or worse, you missed the open enrollment period. So, just to recap things, considerations, and things to to pencil in. Who's healthy in your family, household unit, and who isn't? Household income for 2021, not 2020. Your age. What's your likely job search like? What's the likelihood of a W-2 job with company benefits? And do some soul searching on this versus 1099 gig work. You may need income, but there's lots of ways of getting income. W-2 may be the hardest if you're in your 60s. And then what's your budget? What's your liquidity? Another typo, I see. And then how much have you saved for retirement? Okay, and do you want to dip into retirement in order to cover your family, or to qualify if you're not meeting the 100% of federal poverty limit guideline for a premium tax credit, pull enough out of retirement plan, 401k plan, so that you're eligible for a premium tax credit. And then know your implementation dates, the open enrollment deadlines. But you can decide now, even though open enrollment isn't for a few more weeks, or there's a deadline, in December. No, decide now for each family member. You can always implement later according to your timetable. And if another government subsidy comes along, you can you can tweak this a little bit. But if you make these decisions now, I tell you what, this greatly reduces the stress and increases peace of mind. And there's nothing more stressful on a marriage than being in job search mode. I can speak from experience in the past. You can lay this out in a way, and then you have a plan that you can have a discussion with your spouse and you can agree on, and you can budget accordingly and implement accordingly. It can really improve things and get you all on the same page. In a 5-minute phone call, I'll get the information I need, help you from making a bad decision or no decision. And none of these may be as good as what you had in your last job, okay? But nothing is good except by comparing all these options and doing the slicing and dicing of family members and, doing this kind of stuff. I do this regularly as a business. It doesn't cost anything. Unlike a lot of professional advice, there's no cost, but it will save you a lot of time, and return on time during a job search is so important. Return on time can be reinvested in putting time into a job search and networking. Now, this time of year, I may not read an email until like 2 or 3 in the morning, so phone calls or texts are preferred, and it may take me a day to get back, although I'm usually pretty good about returning phone calls the same day. So what can you do? You can kind of be thinking about what does it look like for your modified adjusted gross income for 2021 now. And then I can help you with it. If your MAGI estimate is too low due to job loss for next year, then how much would you have to pull from retirement accounts to get up to the level? You may be in a really low tax bracket next year as opposed to 2020. So if you're taxed at 10% on withdrawals from penalty if you're under 62.5, or no penalty if you're over 62.5, and a 10% penalty for withdrawals, or I'm sorry, 10% tax on withdrawals. If you have to spend $3,000 or $4,000 with withdrawing from a retirement account, that could save you 2 or 3 times that in terms of subsidies and cost sharing for a plan through the Affordable Care Act. The MedicalInsuranceExchange.com is being held ransom right now by the compliance police. by the insurance companies I represent. I have to get their approval to open it, hopefully to open it. I've got it under review now. The Affordable Care Act plans have a shotgun start, so the actual rates and plan designs won't be available till November 1st. I usually have to take a couple of days to study them once they are available so I can make recommendations. I can send you proposals based on 2020 plans, knowing that you'll have more options and the rates will be a little bit different, but at least get you familiar with them, what's available now, but really you have to wait until November for that. You can be thinking about unbundling, and if you need coverage now, there's short-term coverage you can get in place now, or Christian healthcare sharing ministry programs. Anybody with serious life-threatening, potentially expensive pre-existing conditions you should wait until coverage through the Affordable Care Act if they're not eligible for COBRA. If everybody's on COBRA, you can also disenroll everybody who does not have serious life-threatening or expensive conditions beginning November 1st, and enroll in some of these other options and probably save $400 to $600 depending on your family size. And I'll send you information on the other options. And I don't spam, phone calls and texts are preferred. I don't, if you do go online to most online websites, they will sell and resell your information, hundreds of agents. It's a lead that they can get $50 for or more. And what the new site is designed is to give you the tools that you can do some poking around on your own so that you have a better understanding of what some of these options are for one person or another, and then be able to support you and give you advice once you've gone through that step. Again, I'm waiting approval. It'll be a safe place to do research and then enroll when you're ready. And there'll be more information, but detail. I'm also doing live stream Mondays with Mike, beginning from 5 to 6 p.m. through December 15th. And it'll be ask me anything sessions. Probably don't want to share protective health information, but I can go through basics like examples. You don't want to talk about your husband Tom, who has a serious I don't want to. You don't want to do anything like that on live stream. I can go through the basics and then follow up with the afterwards.
Explain the live stream you're doing. I'm not sure everybody knows
this
about
is
it.
on Facebook Live and LinkedIn Live and YouTube. So connect with me on LinkedIn. I'll put my contact info up there. Or send me a Facebook request or YouTube. Look for Michael Chapman, and this recording will be on. I'll send you the YouTube recording of this link to Mike, who can push it out along with a copy of the slide deck. It's all designed to give you the information you need to make better knowing decisions, to manage risk, and to save money. It's not all about prices, and this is stuff that it's taken me 19 years to kind of get a handle on. Don't try it. It's like, don't do this at home. So live stream will just give you more access.
Mike, there's a couple of questions there in chat. Can you see those?
I cannot. I'm on full stream, but I'm almost through. Let me get to a couple more slides.
Okay.
One more thing. A sobering thought, and this is Fidelity. Came out with this in August. The average couple needs $295,000 in savings after tax to pay for health care. So, it's like you want to keep this in mind and adjust your cost of living and do what you can to be able to save for health care in your future, at least that amount. I think this amount is probably underestimated myself. But the other thing is small changes in your health, like dropping 10 pounds or walking or light exercise, can make a huge change in your quality of life 10, 20, or 30 years down the road. And I see a lot of people that haven't done that, and their life is. I also see a lot of people that are in their 90s that have, and it makes a big difference. One last thing, and then I'll answer questions. Don't underestimate the length of your job search and age discrimination's impact in your job search, and consider now developing 1099 streams of income in addition to or in place of a corporate job, not only before age 65 but into retirement. And then consider where you're going to have your best return on time invested. Going through all the stuff and taking time off of the job search versus spending time with your family or working on your job search. This is just excruciating. It's tough for me, but it's excruciating unless you have the understanding. Okay, that's all I've got. I'm going to leave out my contact information, and I'm going to put this on, let's see, questions.
Mike, I put your contact information or most of it in the chat also.
Let's see. For some reason, I do not see questions. You want to read them off to me, Mike?
Okay, well, one of them was my COBRA is subsidized through February. Can I do ACA and change then, or do I need to do it now?
Great question. No. The Affordable Care Act, you have an open enrollment period of November 1st through December 7th. That's the time that you can enroll. Now you're on COBRA, so if your COBRA extends through 2021, then you can sign up for a plan through the Affordable Care Act either during open enrollment, November 1st through December 15th, or at the end of COBRA, you have a qualifying event that allows you for a special enrollment period, whenever that is. But if you wait until your COBRA is unsubsidized, then plans through the Affordable Care Act are not an option. What you can do is, and also if you're COBRA eligible, then you're not eligible for premium tax credit, if you're on COBRA. So you got to be careful with that. Best to talk to me to clarify things, but you can enroll during open enrollment or during a qualifying event, and loss of subsidy is by the employer is not a qualifying event, but even though it's more expensive, it may still be the best option for an individual in your family that has serious chronic or expensive health conditions.
So if he stayed on COBRA through February, when should he start applying for ACA?
Well, I want to go back a little bit further because it could be that the person's income estimate for 2021 will be beyond what they would be eligible for premium tax credit anyways. So COBRA in most cases is less expensive than an Affordable Care Act plan unless somebody is eligible for premium tax credit. So November 1st is the time that you can actually see the plans for 2021. But, a 5-minute phone call, I can answer and kind of get more information so I can give people more guidance on that. There are too many ifs. If you're on COBRA now, also consider who needs to be on COBRA in your household. There may only be one person or no persons with serious, expensive, or chronic health conditions. But if you're making too much money to qualify for premium tax credit, then that may not be the best option for you. It may be a Christian healthcare sharing ministry program or some other one of the options I mentioned.
Another question was, is ACA offered everywhere?
every state has plans through the Affordable Care Act. 24 states, I believe, have plans through the Affordable Care Act through healthcare.gov. The Affordable Care Act also regulates and manages all group health plans, small employers, large employers, and everything in between. So the ACA individual plans in Texas are through healthcare.gov, as well as 23 other states. I think Arkansas is the closest state that has its own state-based exchange. California, Colorado also have their own state-based exchange, but 23 other states use healthcare.gov.
Okay, I said, would you drop the COBRA and change over early?
Can't answer that without more info. The fact that you're asking that question means, we need to peel back the onion a little bit more.
If you if I have a COBRA, but plan to end it a month earlier, would you have issues with picking up my husband's insurance through his company during the open enrollment? Or would would there be, I think the question is basically if I can go on another family member's plan, how does that affect what happens?
Open enrollment into a spouse's health plan is a qualifying event. You can always drop COBRA. Okay, you can't pick it back up. So you can drop off of COBRA you can jump off that Ferris wheel anytime you want. So you can go on to your spouse's plan during your spouse's open enrollment.
Okay. Any other questions? You can hop on and ask them yourself. I was just reading the ones that were put in the chat.
Yeah, I don't know why I don't see the chat questions.
Mike, I got a question for you that's kind of, I'm going to try to add a little humor to it. It so happened October ended up being my medical care month. I've been to 3 different doctors 4 times, and most of them were for checkups and only and things. But I did not see a stethoscope the whole time I went to the doctors. When used to, that was one of the main things they did was listen to your heart, listen to your lungs, and so on. COVID seems to have changed the protocols they're using, and I guess it's going to put stethoscope manufacturers out of business.
Yeah, good point. That and the Apple Watch, that iWatch 6 and 5.
Well, it kind of disturbed me because, they can get my pulse rate without the stethoscope. They can take your blood pressure without the stethoscope these days. But listening to the lungs was one thing I always thought was pretty important. Yeah. I don't know of anything that's replacing that.
Yeah, good point. Telemedicine is being, a lot of doctors, especially primary care, but even specialty care, chiropractic, it's being done by telemedicine. And, it's just different. Doctors are trying to protect themselves and protect their patients, but, this Zoom world we're living in is really changing it fast, 6 months.
Okay, anybody else have a question? Mike, you want to take your screen down and let's see everybody?
Let's see. Stop share. Cool.
Okay. We lost a few that had to go do other things, but I think once you send me something, I'll try to make it available to people, depending on the size it is, how I'll do that. We appreciate you being with us. And again, you're going to have this Facebook, LinkedIn, what do you call it, a webinar?
It'll be live stream every Monday night from now till December 15th, and on YouTube too.
Okay. And are you taking questions then, or are you just, okay. That's mainly what it is right, is questions.
You can ask me I'll have a little bit, going into stuff that I didn't cover today, but a lot of it will just be available to answer questions.
One of the things that seems to be happening, or that's made the news lately, is some of this COVID testing where they go into like a doc in the box and they get, the insurance company gets charged this huge amount. Is that just driving up what premiums are going to be on this?
Well, the premiums were set really almost before COVID occurred. You could argue that there are so fewer major surgeries that have been postponed, and in-person doctor visits have been postponed, that medical expenses for the year medical claims have actually been down. Now, the whole COVID, who pays for COVID, as a result of those huge, if the insurance companies have surpluses too big, they have to pay it back in the way of rebates, so to their members. So what they've done is use that money to pay for more doctor visits, co-pays, or expanded telehealth or marketing. So they have less of a surplus they have to give back to keep the premiums propped up. The whole COVID thing, there isn't any standardization there. The testing is one thing. 60 days in ICU will set your insurance company back a bunch. And yesterday I just read that two things, that both CVS and Walgreens have signed up, volunteered to have COVID testing in all the retail locations, or most retail locations, whenever the vaccine is ready next year, and that they're pushing regulation. They're pushing the powers that be to allow pharmacy techs as opposed to pharmacists to administer the shots, which isn't the law now. And you try to inoculate that many Americans, they're going to need every pharmacy tech and every stock boy and stock person in Walgreens and CVS to get them done.
Yeah, CVS has announced they're hiring 15,000 people to administer flu and COVID vaccines. So I doubt that there's going to be very high-paying jobs, but maybe.
It'll be minimum wage. Well, might be a little bit more than that.
Okay, anybody else have questions? I'm sorry, Peter, what?
Saying that's almost scary. Minimum wage going in to give you flu shots or vaccines.
Well, that might be a good job if your former boss came in. What else have we got? Okay, Mike, I guess we're used a pretty good amount of time. We'll end your part. You can stick around if you want. I'm going to wrap up with a couple of things and we'll call it a day. Next week, we're going to have Mike, Ray, and Kip Listen come in and talk about the process formerly known as Reference USA. They've changed their name, and so for those of you who don't know, this is a way to if you're in a certain industry, to help you find other companies that are in that